Veneers and dental bonding are cosmetic treatments used to improve the appearance of the teeth. Bonding involves applying a tooth-coloured composite resin directly to the tooth to reshape it or brighten it, and veneers are thin shells that cover the front surface of the tooth. Composite is applied in one visit. It's more affordable and can be easily repaired. Porcelain is stronger, more stain resistant, and usually looks more natural, but it requires more steps and is more of an investment. So most people with healthy gums and teeth are suitable. Ideal candidates have concerns such as chipped teeth, small gaps, uneven edges, worn enamel or discoloration. You may need to address issues like gum disease, large cavities, severe grinding or unstable bite problems before cosmetic treatment can be done. So composite bonding is usually completed in a single appointment. Porcelain veneers are typically 2 visits, one to prepare and scan the teeth and then one to fit the veneers. And then there's usually a review appointment for both treatments afterwards. Both treatments are generally comfortable. Composite bonding often doesn't require any drilling or anaesthetic. For porcelain veneers you may require a small amount of tooth preparation and that might require numbing, but after treatment normally fine. Some people experience a little bit of sensitivity, but that normally settles after a few days. So composite bonding typically lasts between 3 and 7 years, depending on your habits and how you look after them. Porcelain veneers last much longer, probably about 10 to 15 years or more. Porcelain is more durable and resistant to staining and less likely to chip. Composite bonding normally requires some repairs over the years. Care is simple. Brush and floss is normal. Attend regular checkups and hygiene appointments. Definitely avoid biting hard objects like pens, fingernails, ice or certain foods. Wear a night guard if you grind your teeth. If you have good habits, these can significantly extend the lifespan of both materials. You can eat and drink normally, but it's wise to avoid excessive biting on hard or crunchy foods with the treated teeth. Composite can stain more easily from tea, coffee, red wine and smoking, whilst porcelain is highly stain resistant. So that depends. Straightening aligns the teeth but doesn't change the shape, size or the edges. So if you have chips, uneven tooth shapes, small gaps or wear, bonding may still be recommended after orthodontic treatment to refine the final look. Yes, so bonding and veneers may not be suitable if you have active decay, gum disease, severe grinding without protection, very weak or heavily filled teeth, so crowns might be better in this situation. But your dentist will assess these factors during their consultation. So bonding can usually be replaced quite easily in the dental chair. Porcelain veneers can sometimes be repaired, but often need replacing for the best result. Properly done veneers involve minimal tooth preparation and should not significantly weaken the tooth. And if a veneer fails, it can almost always be replaced safely.